The symptoms of a herniated disc depend on the location of the herniated disc and what nerve is being compressed. In the cervical spine, it will press on a nerve that usually extends from the neck into the shoulder and down the arm. It can also cause numbness or weakness. In the lumbar spine, it will press on one of the nerves that go into the leg and can cause numbness, pain, and weakness down the leg. A herniated disc in the spine is caused by the movement of the central part of the disc through the fibers that are on the outside of the disc. The fragment pushes out and hits the nerve or the spinal cord in the spine. It is most common in the lumbar spine, also occurs in the cervical spine, and very rarely in the thoracic spine. As always, the most important test in the diagnosis of a herniated disc is the physical exam. But we also need a diagnostic test to tell us exactly where the disc is herniated, and the most commonly used diagnostic test is an MRI scan. We also use other tests, including nerve tests called EMG or nerve conduction studies, to help us figure out which level is actually being affected. And very rarely we'll use something called a myelogram, which will give us another view of the cervical or lumbar spine. About 50% of herniated discs recover without any intervention, and most of those will recover within the first 3 months. During that time, people restrict their activities, take anti-inflammatory medicines, and sometimes do physical therapy. If the pain is severe, then an epidural steroid injection may be helpful. During that time, you're waiting for the body to see if it will resorb the herniated disc, which means it will chew it up and the disc is gone. If it doesn't get better, or if the patient has significant weakness or numbness, then surgery is probably a good option. This is a very minimally invasive surgery and has a very high effectiveness rate. The benefits of surgical treatment for a herniated disc are that they get the patient better, faster, and have a lasting effect. The success rate for a herniated disc is about 95%. The risks are primarily related to injury to the nerve, which is quite rare during surgery as it is quite a minimally invasive surgery, and the potential of reherniation in the future, which is about 5% in the patient's lifetime.